Hello friends, I'm Dr. Amit and we're going to discuss the hair transplant education series, and in this video I'm going to talk about how I make the decision for a single stage hair transplant or a multiple stage hair transplant. So if a patient comes to us with a larger baldness, how do we decide whether we should do a single stage procedure or a multi-stage procedure? So we've done over 5,000 hair transplants in the last 12 years, and through our centers Divine Cosmetic Surgery, we are operating in Delhi, in Gurgaon as well as in Mumbai. Dear friends, thank you for watching this video. Please like this particular video and subscribe to my channel. This will give access to all the upcoming amazing videos that we are going to put up, and also open up all the other videos that I have posted so far. So the concept of single versus multiple stages only comes in when the baldness is more severe, say grade 6, 7 and 6 and beyond, really 6, 7, etc. Number of patients ask us whether it can be done in single stage. Some patients also ask us that should we stage it into multiple sessions. So let's understand the science behind it, the advantages and disadvantages. If a patient has grade 6, we can cover everything in one go. We require 6,000, maybe 6,500. Grade 7, we sometimes require up to 8,000 follicles, and that can easily be covered in one go. However, some patients ask whether we should do it in two stages. So what we can do is we could do 5,000 in one go and 3,000 or 3,500 as a second session. Why? So one are budget factors. Secondly, in combination hair transplants, we have to trim the hair. Whereas a patient might not be comfortable with trimming the hair. It is possible that they want to cover a larger area without someone knowing they have done a transplant. So they may want a long hair transplant. You would have seen my video on long hair transplant, which tells where when we do a transplant, nobody can even know you have done a transplant. So in that scenario, we have to do 5,000 and then another session. So if a patient is okay shaving, then we would rather do it in one go. If not, then two stages of the long hair transplant procedure. Then in more severe scenarios, say we require 9,000, we require more than 9,000, 10,000. We know that sometimes we can only take up to 9,000 follicles and some area might be left. So we explain to the patient that we've covered so much, just leave the rest of it for future, because if it's a small area of baldness, it really doesn't matter. Alternatively, we can do 5,000 in two divided sessions. So 5,000 first time and 5,000 second time, and cover the entire area. So this will give you an idea of how we want to select. So basically it depends on an interaction between the patient and the doctor, depending on the hair quality, the extensive baldness or less extensive baldness. These are the deciding factors to choose whether surgery should be done as a single stage or a multiple stage.